Hello, I'm Gregor Thomson and welcome to my new podcast / YouTube show, In Context. I'm obviously just sort of winging this because I'm not quite sure what I want to cover or who I want to talk to, but I'm thinking I'll explore a different topic each show. My main goal here is to provide a deeper context into these topics because I think we live in a very surface-orientated and headline-orientated world, and I think we need more depth and context to fully understand something or someone. This won't just be me complaining for an hour, however. I'll have some conversations with more interesting people about the week's subject who can provide an expert's point of view. So this week's topic is obviously coronavirus or COVID-19. Now, as of filming this, which is 11th of May, COVID-19 has killed just over 280,000 people worldwide, over 30,000 people in the UK, and just over 1,800 in Scotland. These are devastating numbers, and these numbers are even more tragic for the people who have unfortunately lost someone because of this. The hospitals here and worldwide have been overwhelmed by the number of people who need them, and they, alongside care homes, have been hit the hardest with shortages of protective equipment. And to me, the amazing amount of charitable donations and fundraising that's taken place, while they are inspiring to see, they show the whole world is incredibly unprepared for pandemics. Scientists from around the world for years have been warning the inevitability of a crisis like the one we're enduring now, and our governments simply didn't take them seriously. Even Bill Gates predicted this. Even closer to the introduction of this pandemic, the UK government could see the increasingly devastating effects of COVID-19 in other European countries and still chose not to introduce restrictions. This also paints a scary picture of a future as increasingly sceptical of objective science. You won't have to look at Donald Trump and his followers to see the extreme effects of this. Remember what he actually recommended doing as a cure.
And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or...
In the US, Trump is allowing state governors to control their own restrictions, and some are reopening the economy at the end of this week, against the advice of scientists and basically anyone else who's considered an expert. This could show how these significant missteps could affect the death toll and the economy, which is ironic because those in charge are trying hard to protect and better the economy. But if they reopen too soon and the caseloads increase, they'll have to reintroduce restrictions and the economy will suffer even more as a result. I also want to talk about the media's handling of COVID-19. I'm constantly seeing people in hospital receiving treatments who explain their horrific experiences living with the virus, and I feel very much for these people and their loved ones, but the facts are, they're the minority regarding people who have contracted COVID-19. Most people develop mild symptoms or don't show any symptoms. I'm not saying we shouldn't be learning about the worst case scenarios, and I'm not saying these cases are not deeply disturbing. I'm saying we should be seeing people who had milder symptoms alongside those who experienced the worst. That's the true impartial picture of the virus. There's a lot of focus on people under 40 who have sadly died from COVID-19 as well. Yes, these are terrible to read or watch, but the percentage of people under 40 who have died from COVID-19 is extremely low. Again, I'm not saying these shouldn't appear in the news, but there's a considerable amount of focus on these deaths when they are extremely rare. And lastly, I want to talk about some context about our leaders right now and their track record, so we don't make them the saviour of our nations for their handling of the coronavirus too soon, forgetting the crucial context of their past. First, I'll start with Nicola Sturgeon. In 2015, reports showed contradictions in SNP's assurances that they were improving health standards when, in reality, NHS Scotland was facing substantial problems with declining standards of patient care. This was put down to tightening budgets combined with rising costs. And let's not forget the SNP's handling of Scotland's extremely problematic drug use issues. The SNP have been in power for 10 years, more than 10 years. The deaths due to drug use in Scotland have continued growing, giving Scotland the highest amount of drug-related deaths in Europe. Scotland may have very low numbers of COVID-19 deaths, but we're definitely failing thousands of people in need who are dying needlessly. Now, we all know Boris Johnson was unfortunately in hospital for COVID-19. Unfortunately, he was given the all-clear, but let's not forget his track record regarding the NHS. Remember this bus? Let's also not forget that the Prime Minister of Britain missed 5 coronavirus COBRA meetings in the build-up to the crisis. He also praised the nurses who looked after him in hospital. One was from New Zealand and another from Portugal. The praise has been welcomed, as it should, but let's not forget Johnson's Secretary of State Priti Patel's proposed points-based system for immigration, which would stop thousands of immigrants from entering the country. The NHS's reliance on foreign nationals cannot be overstated. As of 2018, 1 in 8 NHS workers were foreign nationals, and this would also stop many immigrants from joining the UK's caring professions, which are considered to be low-skilled according to this system. Luckily, experts, health leaders and trade unions have rounded on the government's new immigration policy, warning it will be an absolute disaster for social care services and put more pressure on the NHS. And let's not forget the Conservatives in general imposed 10 years of austerity, which led to record shortages of nurses and beds. Now, it may be quite obvious to some people that Donald Trump's handling of the coronavirus has been, well, less than ideal. What with the whole disinfectant injection thing, denying science, and of course this.
But I think importantly, anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful.
So surely we'll look back on Donald Trump as the third president to be impeached, the coiner of new words, and the one who simply couldn't care less about the media's questioning.
When this was mentioned to me, I said I was delighted that I get to have the vice president helping in this way. Delighted. Absolutely.
Will you answer a few more questions?
Enough tonight.
Now, since this week's topic is the coronavirus, I thought I'd interview the most important people during this crisis, the politicians. I'm just joking. It's the frontline workers, the ones who are saving our lives, helping the most vulnerable, and going to work every day to make sure we are all safe.